All right, lines, wrinkles, dark circles. Yep, the signs of aging, they aren't always fun, but what if you had a non-surgical way to reverse some of those pesky problems? Dr. Tamara Rogers, owner of Dr. Rogers Centers, is here this afternoon. And yeah, a lot of people, Botox and this and this and that, and you've got a whole new way of doing things. And we've got some great before and after photos again.
Yes, yes. So basically what we're going to use is start using fat, and we're going to use that as your filler. Fat's been around, we call it a fat transfer, for many, many years, but it was only able to be done in the operating room. And so now what we're able to do is bring it into the clinic. There was a doctor in Belgium that invented a new way to emulsify fat, and I was able to train with him in San Diego. So now we can basically use your fat like a natural filler.
So what signs of aging can fat take care of? We're see the picture.
Yeah, so you saw like you've seen the hands. As we get older, we lose that volume in the hands. This patient actually had scleroderma, and you can see we went in, which is a disease of the skin, and we're healing that through the stem cells in the fat. And then the first person actually had a facelift in the past, but didn't have any volume. So we went in and we used our fat to regenerate her skin, and then also to replace that volume on her face.
Basically anybody a good candidate for this?
Anybody is really a good candidate because we're basically using your own fat. So we don't have a reaction to it, and it's going to be natural, and it's basically going to help your body heal just with all the natural stem cells that are actually in the fat.
And we're talking about a non-surgical fix. So the whole process with this is you have to liposuction.
We do a small area of just mechanical liposuction, yes.
And what's interesting is where you do the liposuction.
Yeah, we really love that. Nobody likes flake fat, right? But we love flake fat because, yes. So we love that because that really gives us, we know beyond getting the fat, we know we're getting the most stem cells for the regeneration in that area.
Because that fat is different than fat
metabolic fat, yes.
So then you take, and like you said, you just squeeze this stuff down and get that fine and inject it.
Right. So now we're able, a lot of people have Botox. We use a really tiny needle for Botox, and now we're able, with the emulsification of the fat, to get it into a liquid form so that we're able to inject it. So it's much less, the pain is not much at all when we do it. Plus, we can use small cannulas now, and so we can do any area of the face. And unlike regular dermal fillers, we can go a little bit more superficial, so the tear trough areas and really those fine lines and wrinkles that we couldn't do with traditional fillers.
So you get the little liposuction done in the office, right?
In the office,
whole procedure,
right.
Injected, and then you said you can go the next step right away.
Yeah, right away. Normally, when we do traditional fillers, we can't do any type of skin resurfacing. So what we want to do is immediately when we finish, we'll do either a CO2 laser or we'll do what's called a micro pin, and then we'll actually have some of that residual fat and apply it to the face. So now you're using those stem cells to regenerate your face too. So you get it all done in one session rather than having to go and get a laser, one step, and then go and get your fillers another step.
So you're thinking, okay, you got to do the liposuction thing, you got to do this, you got to do that, and how does that compare to the, just pull out the needle with the filler in it? Price-wise.
Right. Price-wise, believe it or not, it's going to be cheaper. So a lot of times when we do these procedures, we're able to charge half of what we normally would charge with traditional fillers.
Because
we're using your fat.
And the other stuff is the actual...
That's right. We have to pay for all those fillers.
The labor costs are basically less than the product cost of the other one.
Absolutely.
Okay. And you've got a special going on for viewers right now?
Yeah, so we're going to give $500 off anybody that calls us and sees this today. And we always offer free consultations, and we can talk about what we can do for you.
And it's your own fat just getting put back in those little wrinkles and everything.
Yeah.
Okay. Well, doctor, thank you very much. For more information on this procedure, please call 210-495-2117. That's 210-495-2117, or go online to drrogerscenters.com. Happy Valentine's Day.
Oh, you too. Yes.